if you're in your 50s and you're concerned with the changes you're noticing in your skin and in your face, what are the treatments or products worth investing in for you? Now, I will start by saying that skincare is always worth investing in, but how much difference you'll notice from skincare alone depends on what your concerns are and on how advanced your aging process is, because some people have been investing in skincare since their 20s, and so the changes in their skin in their 50s will be less than someone who hasn't done anything to support their skin. But you can never go wrong by having a good medically based skincare routine, and it's never too late to start using sunscreen. Every single day, unless you need a torch to see, you should have sunscreen on. But if your main concern, for example, is a jowl, then the benefits of skincare will be less for that than they might be for improving your skin texture. So it depends on what your focuses and priorities are, but skincare is always worth investing in. It's just important to have realistic expectations about what it can do. When it comes to treatments, for most patients in their 50s, the core pillars of what we're using are a combination of fillers, biostimulatory injectables, and devices. Fillers restore volume, and we have to bear in mind that volumetric changes happen in the face, both in the fat layer and in the bone. So when we use fillers, we can be very strategic by examining you and really deciding and understanding what's changed in your face and what tissue we believe you've lost, and therefore we can use fillers to restore that volume. Biostimulators are also an excellent choice, and my particular favourite here is actually a product called Harmonica, which is a hybrid injectable. So that means it fills, but it also biostimulates to provide some skin quality improvement, so changing the skin architecture. And biostimulatory injectables, these are ingredients which are shown to stimulate collagen production. And bearing in mind that collagen loss starts around the age of 25, and we lose 1 to 1.5% every year, with this big increase for women around perimenopause, I think it's important to realise that collagen loss is relatively significant by the time we hit our 50s. So biostimulatory injectables, either as a standalone or, as is my preference, using Harmonica, can provide really tangible and measurable changes. Devices are also a great option, be that soft wave using ultrasound parallel beam technology to tighten the skin, or using a radiofrequency microneedling device. And my favourite here is the Profound RF, which is shown on clinical studies to be about equivalent to a third of a surgical facelift. But we can use it through sort of this lower section of the face and the neck area to provide some real jawline improvements. And let's face it, the jawline is a primary area of concern for most people in their 50s. I also think it's really worth thinking about hormone replacement as a treatment option here. I'm not suggesting you should be on hormone replacement therapy just for your skin, but by our 50s, bearing in mind the average age of menopause for a woman in the UK is 51, there has been a significant decline in hormone levels, and that does play an impact on our skin, because our skin cells, our fibroblast cells, have estrogen receptors on, and once these stop being activated, so when perimenopause and then menopause hits, there's a significant decline in their functioning. If you are struggling at all with perimenopause, we know that skin changes, positive skin changes, are a benefit of hormone replacement therapy. So it's certainly something to consider. And then we also have to say that in this decade, surgery is an option for many people as well. Some people who seek me out say, I'm not ready for surgery yet, or equally, I never want to explore surgery. But I think it's an important thing to think about, because if surgery is something that is on your radar at some point, or something you're prepared to consider, then it can be worth thinking about it, and definitely considering the impact that non-surgical treatments could have on a future surgical procedure. And that's something a responsible injector will always consider with you during a consultation.
If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.